Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and I want to talk about how we can live longer, which is obviously one of our goals, live better, live longer. There was an article in the New York Times just this week by Gretchen Reynolds, and she wrote, if people need motivation to get up from their office chairs or couches and become less sedentary, 2 new studies provide the impetus. One found that sitting less can slow the aging process within cells, and the other one underscores that standing up, even if you're standing still, can be good for you as well. And obviously everyone's motivated to exercise and do other things, but unfortunately we spend a lot of time seated. She writes that the most common waking activity is sitting, and many of us sit for 8 hours or more a day. She writes the health consequences are well documented. Studies have shown that the more time you spend seated, the more likely you'll have diabetes, heart disease, and other conditions and die prematurely, even if you exercise. So for the first time, there's been studies, and it was published in the British Journal of Sports Medicine. Doctors in Sweden decided to mount an actual experiment where they look at the chromosomes based upon how much time you're seated or not, and they actually look at the people's telomeres. So telomeres are the caps on your genes. They shorten and fray as the cell ages. It's not just by age. They can happen by obesity or illness. They can cause shortening of the telomeres, causing cells to age. So in the new experiment, doctors recruited a group of sedentary, overweight men and women, all age 68, and drew blood to measure their telomeres and their white blood cells. And half of the people were encouraged to have moderate exercise to improve their general health, and they were advised to sit less. And the other group were told to continue their normal life. The scientists encouraged them to lose weight and be healthy without any specific methods. And after 6 months, all the people came back for a second blood test, and then they looked at the telomeres, which is a relationship to how the cells are aging. And the exercise group were exercising more, but for the most part they were seated just as much. When the scientists compared the group of the people who were encouraged to sit less, they found the telomeres in the group that were sitting the least had lengthened. So actually the cells were getting younger if you were seated less during the day, unrelated to exercise. So there was little correlation between exercise and telomere length. In fact, the exercise group who had worked out the most tend to have less lengthening than the people who had stood up more. So reducing sedentary time lengthened telomeres and may help slow the aging process. So the point of this study seems like it's get out of your chair and stand up. Even if you're not exercising, stand up. Interesting. And over the last weeks, I've talked to you about a man who came, he had kidney cancer, went to other doctors, and they removed his kidney. Now, he came to me, and you might remember it because of his pain. He had pain in his penis. So he had pain in his penis. We worked him up, and we actually found cancer in the other kidney. Now, other doctors wanted to cut out the second kidney. That would put him on dialysis. With us, we were able to treat him with radiosurgery, and he completed that treatment and has done great. But it still didn't describe why he had the pain in his penis. So we looked in his bladder, and actually he found just this week an invasive transitional cell cancer in his bladder. So he has 2 separate cancers. And it's like I talk about back in Iowa. When you get to a railroad crossing, they'll tell you how many tracks there are, because some people, the train passes, they get in their car and start going, but there's another train that can wipe them out. Well, in this man, had we not looked in his bladder, we would have treated the radiosurgery lesion in the kidney probably successfully. Our success rate is very high for kidney cancer, but it would not have explained the pain. So in him, we found a high-grade bladder cancer. Now, he does not want surgery, and there are other methods like radiation, radiosurgery, to treat bladder cancer successfully with a high degree of success and keep the quality of life. So for him, thank God, we checked all the railroad tracks before we started the engine. We found 2 separate, unrelated cancers, which is not common. Very few people have 2 separate major cancers. I'm talking about skin cancer, which is almost ubiquitous cancer, but something that here has a kidney, and totally unrelated, a bladder cancer, and he has chosen to proceed with us, non-surgical option for his cancer. Another person came to us, a 63-year-old woman, a black woman. I say that because breast cancer in the black community has twice the mortality rate. And this may be an example. Most of it's due to waiting. This woman found her cancer in March 2014. She didn't have any mammograms for many years. So she had a left breast cancer. There had 2 spots in the breast. She's been seen by doctors who wanted to do cutting and surgery and mastectomy. And, well, they didn't even stage her up. So she's seeing me 6 months after it was diagnosed, still with no treatment. But we're going to stage her up. We're going to know exactly where the cancer is first. Because don't you think it makes a difference where the cancer is before you get the treatment? I think so. I think you want to know where the cancer is. That will give you an idea of what's going on in your body, and then you can make better decisions rather than just focus on that one area and ignore 98% of your body. And with another man who came from China with a Gleason 8 cancer. Now, he has an elevated PSA, 4.67, and Gleason 8. Gleason was a pathologist. He tried to tell us how aggressive cancers would be. He made a scale from 2 to 10. The higher the number, the more aggressive the cancer. Now, if you look in our booklet, which we'll be happy to send to you at no charge, our booklet and DVD, we have a separate booklet just about prostate cancer. And if you look on page 11, you will see our results for Gleason 8 cancer compared to, let's say, 2 major Ivy League hospitals, one in Philadelphia, one in Boston. Their best results for Gleason 8 cancer was 30%. Our results are more than double, about 125% better than their results. In fact, much better than their radiation results, better than their brachytherapy results, better than their radical prostatectomy results. And we know that most men want to avoid radical surgery for prostate cancer. There was a recent report from medical school in Boston that showed that 97% of men who had surgery had sexual problems, 80% had urinary problems after open or robotic surgery, whereas with us, most men keep their sex life and urinary life, and most men, even Gleason 8, 9, 10, prostate cancer, are cancer-free. It's a great program, and we've, in our book, compared our results to Proton Beam, to other centers in New York, Chicago, Texas, California, as well as these Boston and Philadelphia programs. So you can actually look at your risk, whether it's PSA risk. PSA is prostatic-specific antigen. It's that blood test risk, or the biopsy Gleason score risk. And you can see what the success rate is before you have surgery. So imagine if you knew that with surgery your success rate was only 30%, and with us it's 125% better. I think that would motivate most men to get a second opinion, and we encourage men to get a fresh second opinion, like this 64-year-old Chinese man with 2 children, Gleason 8, PSA 4.67, who, after he saw the data, wishes to proceed with treatment. And we had another woman who came in with recurrent ovarian cancer from Maine this week, from Portland, Maine. My mother's from Portland, Maine, so I have a great connection with Maine over not 100 years, but my family's been in Maine for more than 100 years. This woman is 58 years old. She has a recurrent ovarian cancer. She had vaginal bleeding in 2010. She was found to have a big pelvic mass. She had elevated cancer marker. CA125 was elevated. She had surgery and chemo in the veins, chemo in her abdomen, and she did okay until 2013. She had a repeat surgery. Surgeons tried to remove cancer in the liver and the pelvis. Well, they couldn't fulfill their ambition. She was left with cancer in the pelvis. She had chemotherapy, which didn't work. She now has a huge mass in the pelvis and huge pain. She's having difficulty urinating, difficulty moving her bowels. I think she spends the majority of her time in the bathroom because she's having so much trouble. She saw other doctors around the country who had no experience. Well, we have a very extensive experience. In fact, I recently talked about the woman, a similar woman with a 13-centimeter mass that we treated that went away by about 90% with just 5 treatments. So we spoke to her about staging, we spoke to her about treatment, and now she can decide. She has a great husband, and they would decide about how they're going to get this cancer problem solved. We think that we can help her a lot. And another woman who came to us this week had metastatic melanoma. Now, melanoma is one of the most difficult and malicious skin cancers. It's believed to be related to sun exposure. She's had a lot of standard radiation and chemotherapy elsewhere. She is a divorced 73-year-old woman. She has 2 children who came with her. She came for a second opinion. She had a melanoma on her back 20 years ago. It was resected and then came back in the same spot and had surgery again and standard radiation again. And she went to big cancer centers, had interleukin and chemo. And now she's had all this treatment, but it hasn't worked. And so she's come to us about treatment options. Now, she's a very vital woman, fully functional. If you saw her walking down the street, you'd say, wow, what a nice, great woman. But in fact, she has very extensive cancer. She's decided to proceed with radiosurgery and innovative treatment. Our success rate, again, is about 90% for melanoma. Melanoma was considered radio-resistant, which means not responding to standard radiation, which is true. But when you zero in, hit the cancer with focused beam treatment, just a few treatments, but higher dose, it's much more effective therapy. So there's a biology to the radiation, something called radiobiology. And so the effectiveness of radiation is different if you give low doses or if you give high doses. And it only makes sense. A few focused higher dose treatments are going to be much more successful in melanoma and sarcoma and kidney cancer, like we spoke about earlier. And this woman is going to be treated for melanoma like so many others who have come to us over the years. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We take care of patients with cancer or masses in the body, whether it's in the prostate or the breast or the lung or the neck or wherever it is. You can give us a call at 212-CHOICES during the week, or actually anytime with a medical question, and we'll be happy to answer your questions and arrange for you to have a fresh second opinion. We're going to hear from a couple of voices about our work, and we'll be right back with more news.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life.